There's been a largely talked about diet recently. It's called the ketogenic or keto diet. We can't help but wonder, what's all the fuss about? In this presentation, we're going to explain what it is and what happens to your body during ketosis, the food restrictions, long-term versus short-term effects, and the benefits of this diet and why somebody would try it. Firstly, I will explain what the keto diet is and what happens to your body during ketosis. The keto diet is a low in carbs and high in fat diet. It is designed to help you burn off fat more effectively. You get majority of your calories from protein and other things very high in fat. For example, a lot of people like to eat seafood on this diet, such as mussels, clams, and oysters, and like to get a lot of their protein from that. And some high in fat things that people like to eat would include avocados as well as flax seeds and chia seeds due to the fatty acids that they contain. You're eating things that are harder to digest, so basically your body is working harder to digest the food that you're eating. When you refrain from eating carbs and can't burn that for energy, your body then goes to burning fat. Burning the fat creates ketones, which are a type of acid that it will then go on to use for energy. This is the metabolic process of ketosis. Typically, the diet needs to consist of about 75% of fat, 20% of protein, and 5% of carbs to reach and maintain ketosis. However, it is important to note that this may vary from person to person. It may take some a couple of days, like 2 to 4, to reach ketosis, while others it might take a week or more. So it just depends on the person. And to know if you're in ketosis, you can take a urine test at home to check the ketones in your system since they're eliminated through your urine. I know that sounds weird, but it does help to check and see if you are in the process of ketosis to know if you need to change anything about your diet.
The keto diet is a high-fat, low-carb eating plan, as you now know. With that comes food restrictions. The keto diet calls for restricting your daily carbs between 20 to 50 grams. Restrictions on the keto diet include some of the following. Keep away from foods full of sugar. Sugar is a big no-no. Avoid sweets, candies, cake, and cookies. Stay away from grains such as cereal, bread, pasta, oats, or rice. Along with those restrictions, avoid starchy vegetables like corn, peas, beans, potatoes, and lentils. The sugary drinks like soda, sports drinks, or fruit juices should be avoided as well. Limit your fruits high in sugar like your bananas, pears, citruses, and mangoes. Lastly, avoid alcohol. Water is the most important. Drink lots. Drink half your body weight in ounces. Some effective tips to get into ketosis are the following. First, you want to minimize your carbs. Eating a very low carb diet is the most important factor in achieving ketosis. Secondly, olive, avocado, or coconut oil should be included in your diet. Many reasons people fail is because they are not getting enough of the right healthy fats. Consuming plenty of healthy fats can boost your ketone level and help you reach ketosis. Thirdly, ramp up your physical activity by getting some sort of activity each day. Trying an intermittent fasting by without eating for several hours is another way to get your body into ketosis. Next, by maintaining the adequate protein intake that is required is key to reaching ketosis. Start by decreasing your stress. Stress hormones elevate your sugar levels. Lastly, prioritizing your sleep. It's critical to get at least 7 to 9 hours of sleep each night. If you aren't, it prevents your body from getting into the fat burning mode. Those are the restrictions one must follow to reach ketosis, along with some of the tips to help you be successful on this diet.
I will be talking about the short and long-term effects of the ketogenic diet. We'll start with the most popular, weight loss. In the first 3 to 6 months of starting a ketogenic diet or other low-carb diets, there's an increase in the first 3 to 6 months of weight loss. Some other short-term benefits of the ketogenic diet are low triglycerides, lower total cholesterol, raised HDL cholesterol, this is your good cholesterol, lower blood pressure, and improved insulin resistance. The ketogenic diet has also been shown to help with some other conditions, such as polycystic ovary syndrome, neurological disorders, acne, and cancer. There isn't a lot of data about the long term for the ketogenic diet. Mainly it's surrounding the GLUT1 deficiency syndrome, and this has to do with epilepsy and movement disorders. There was a 10-year study done on children, and in the study, in the first 6 to 24 months, the children showed a thickening in the intima of the carotid artery, that's the innermost lining of that artery, as well as increased blood lipids, which was concerning towards cardiovascular risk. However, at the end of the study, they showed similar blood lipids to before they started the study, similar BMI to before they started the study, as well as no real cardiovascular risks, and blood pressure that was close to what it was before the study. Other long-term effects are better body weight long-term for folks, as well as better cardiovascular risk management. And there were some animal studies that were done that showed damage to the kidneys. However, that same type of data has not been seen in the human studies.
Lastly, I will talk about the benefits of the keto diet and why people are hopping on the keto diet trend. Some reasons why this diet has become so popular are the transformations all over the internet of before and after pictures of how this diet was successful for others, easy recipes and keto-friendly ingredients all over the internet, giving everyone the resources they need to be keto-friendly and be successful in the diet, celebrities including Kourtney Kardashian, Vanessa Hudgens, and Jenna Jameson swore by this diet and shared their tips and recipes to help others that are going to try this diet or who are already trying it. The Magic Pill documentary on Netflix came out May of this year, and the doctor in this documentary argued that the keto diet can cure cancer, obesity, and liver diseases. Needless to say, people had mixed emotions about these bold claims, yet it was still a good reminder. While there are plenty of benefits, there is no magic pill to good health. The keto diet has many benefits, including weight loss. It takes more work to turn fat into energy than it takes carbs into energy. Because of this, it can help speed up the process of weight loss and doesn't leave you hungry. It can also reduce acne. Eating a diet high in processed and refined carbs can alter gut bacteria and cause more dramatic blood sugar fluctuation, which can have an influence on skin health. It can also help reduce cancer. It can promote good heart health and reduce cholesterol levels, potentially reduce seizures. It was thought that the combination of fat, protein, and carbs can alter the way the body uses energy, resulting in ketosis. And it can also improve women's health and women with polycystic ovarian syndrome. That is why the keto diet is so popular and the benefits along with it.
In conclusion, you've learned what the ketogenic diet is and what happens in ketosis. We've talked about the dietary restrictions with what you can and cannot eat on this diet. We've also explained the long and short-term effects of this diet. And now that you know the benefits and why this diet is so popular, you might consider doing it for yourself. However, we strongly recommend that you talk to your healthcare provider before starting any new diet plan. Thanks so much for listening.